This morning, the Oregon Health Authority is narrowing which mental health providers are eligible for full Medicaid payouts as of the beginning of the year. And now, just 2 weeks in, providers are pushing back, saying that this change will have big repercussions. Sunrise reporter Thomas Schultz joins us from Northeast Portland. Now, Thomas, how are behavioral health care providers reacting to this change?
Yeah, China, I spoke to a psychiatric nurse practitioner that is out in Eastern Oregon who says that this is being instituted very quickly with little insight from these nurse practitioners. He said it could have a big impact as well on payouts, sometimes of 10 to 20% for providers. And he says, once again, this is coming in a month's notice for them. That's a big problem for his practice in Eastern Oregon, where 60 to 70% of patients are on Oregon's Medicaid program. The Oregon Health Authority is also narrowing who is eligible for full behavioral health payouts. They say the changes are meant to counteract increasing cost and to ensure only providers who offer team-based care will be eligible to receive full payment. Those are providers who have things like peer support workers, specialists, and case managers. Still, Trevor Ratchko, the nurse practitioner we spoke to in Pendleton, says those are roles that bigger organizations have. At mom and pop shops in Eastern Oregon, many providers don't have a staff large enough to fill all those positions.
Disproportionately affects anyone who's rural. I would say anyone who's outside of a major metro area, in fact, because you see less of these services out in those areas.
Still, the Oregon Health Authority says these changes are meant to improve the conditions for patients across the state. Of course, providers like Trevor Ratchko continue to push back on that thought. This is something that is continuing to develop, and of course, we will continue to follow closely.